I'm Dr. Kirk Lane. I'm from Texas originally. I was born in Amarillo, Texas, went to college and high school in Houston, Texas, and medical school in Dallas, Texas, at the University of Texas Southwestern Medical School. And I like to tease Dr. Coville and tell her that's Texas's premier medical school because she went to the medical branch in Galveston, which is one of our sort of rival medical schools. Moved to Black River Falls in June of 2001. I started at the Crohn Clinic and at Black River Memorial Hospital in August of 2001. Since moving to Black River Falls, initially my family and I bought a little house in town and got to know some people, got to know the community. Subsequently, we've moved just outside of town, but I'm almost exactly 2 miles from the hospital door, which works out great for riding my bicycle into town. I'm married, been married for 20 years. My wife is Michelle. Michelle is into sheep and all things knitting and wool. So she has baby doll sheep. We also have chickens. She spins wool, she knits, she also paints, sculpts, does all sorts of art related things. I have a daughter Haley, who is 17, and son Evan, who's 11, and they're great kids. Certified in family practice since 2001. I did complete a family practice residency, and so that would be, of course, my core area is family practice. My approach to family practice is cradle to grave. I do obstetrical care. I have extra training beyond the normal standard family practice training in obstetrics. So I'm capable of doing cesarean sections, complex repairs at the time of delivery, DNC, tubal ligations. I also do a procedure, hysteroscopy, checking the inside of the uterus for cancer or polyps. I do endometrial ablation for women that have severe periods that are disrupting their life. I also do ultrasound of the heart. That's something Dr. Mann and I got interested in, and I've been doing that for 5 years. That's called echocardiography. So we do resting echocardiography, not the echocardiography that you swallow the probe, thankfully. No one likes to swallow an echocardiogram probe, but the echocardiography across the chest, just standard chest ultrasound.